overnight before they can reach a nurse, when they're lucky a doctor. It means that several women will have a poor adherence to their treatment. Some are not coming, and we can see in the clinics that they were out of pills for a long time.
Ke bona ho le hole kapo ha se kanti ke bona ho le hole empa fela he ka ha motho bo tlameile ke penyeletse fela ka ha hona jena ne le kgatlo la bobedi ke ile ne ka hlolwa ho ya ke tshwere ke maoto.
When a pregnant woman doesn't take her treatment correctly, it increases the risk for her to transmit the virus to her child. To herself, it means that her treatment will not work properly. And so even if she continues taking the pills, she will get sick. When an HIV patient doesn't take treatment or they're resistant to treatment, they die. Okay. So this is yours. Over here, women are dying much more than anywhere else in the world during their pregnancy or just afterwards.
HIV is the main cause of death of young women, of women in sexual reproductive age. That is the case for Lesotho, that is the case in the world at the moment. These deaths are completely avoidable. They don't happen where women are tested and started on treatment in time.
We came across a family in need with a girl who is HIV positive. Her mother died not so long ago. She's sick. We need to see if she needs antiretroviral treatment.
HIV positive pregnant women and mothers have a high risk, around 30%, of infecting their children. That is totally preventable. If that woman is on antiretroviral therapy, she will not, or almost not, infect her child. An HIV-infected child means either he's going to die before the age of 1 if he's not diagnosed in time, or we diagnose him in time, and then he will have to take antiretroviral therapy for the rest of his life.
Minyaka ewu-15 ngaqala ukudla amaphilisi ngo-2007 lapho khona engangazi nokuthi ngadlela amaphilisi.
Uthi kwaqala umntwana emva kokuthi uma wakhe siwashona kwase kuphoqa ukuthi ngimtshele, but khona kwaba buhlungana, kwakubuhlungu lapho kwabanzima khona cause wakhala, kwabanzima nje impela.
Ngase ngambuza ukuthi ngoba ngiyi-positive ngayithatha yona, waseke eyangichazela. Ngase-ke the time engichazela ngabuza ukuthi yena uma wayithatha uma noka akatholanga ulwazi lapho ngoba vele makasekho.
We have specific programs working with children, trying to help parents, because parents are afraid to tell their children they're HIV positive. A child that learns that he's HIV positive by himself almost always gets very angry with the people that lied to him during all these years, and very often they stop treatment or they start taking treatment erratically, which then leads to failure of treatment, to drug resistance, or to illness and deaths amongst young adolescents.
Manje ngiphuza amaphilisi awu-5. Lokho bengathanda ukuthi ngicine sengikwazi noma ukuphuza elilodwa iphilisi.
That girl is asking for drugs that are easy to take. At the moment, we don't have them. We're nowhere near. There's a need for investment and research, but the pharmaceutical industry has shown little interest because this is for poor countries, and children in poor countries are a completely neglected population. For adults, we are there. We have one tablet once a day where you have 3 drugs in one tablet. It's called fixed dose combination.
Kombo nangai mama Claudine Motosia, nazali veuve ya bana 6. Bazwinga na maladi yana ale. Nabandi kozwa bakisi. nazozwa bakisi ofele mais ekomaki na moment moko nakomi kofuta $5. Alors ntango nakati traitement nasalaki rechute. Bon, mpona lelo nazwaka lisusu kisi te, nakoma kosenga na baninga oyo baza na moyen basombaka ba 3 boîtes 2 boîtes. Pour le moment naza na 4 comprimés ezosalanga 2 jours. Nakokwea ka rechute nazwa ekoza mabe na obela na continuer kaka kosenga mpo naza na mbongo te. Kokoko ngai Claudine mwa moke kaka nayeka mpona yo mpo boni santé oza malamu. Ndeko nayaki kaka kotala yo lisusu kisi esili lisusu yango wana ekosenga yo soki okopesanga lisusu ndambo ya kisi.
Aza na moka moke me naozwa otokabola mponga mpe.
Le fait qu'il y a beaucoup de frais à payer avant d'accéder aux ARV gratuits, c'est une sorte de sélection naturelle. Pour les personnes qui sont démunies et qui se voient annoncer le diagnostic VIH, c'est vraiment comme une sentence de mort. La moitié des patients vont tout simplement laisser tomber les bras et attendre la mort. Ce que nous voyons chaque jour dans les centres est les visages humains des personnes qui arrivent tardivement, qui n'ont pas accès au traitement. Les patients sont vraiment en mauvais état général, avec beaucoup d'infections. Il y a un patient sur 4 qu'on ne pourra pas sauver. C'est vraiment difficile pour l'équipe.
C'est fini, bébé, c'est fini, c'est fini.
Beaucoup de personnes continuent à mourir dans nos communautés sans avoir accès au traitement antirétroviral. La maladie au Congo avance plus vite que la réponse organisée.
With untreated HIV, you can treat the infections, but you know that's only gonna have some mild effect and then people are gonna come back. That is what we saw in the 80s in the US and in Europe, and in the 90s in South Africa and in Lesotho. In DRC, you still see it today. We know that we have to put many more people on treatment because people on antiretroviral therapy transmit much less, actually have a 96% decrease in chance of transmitting HIV. The first hurdle is to test more people. And until now, we waited for people to say, oh, I want to test for HIV today. If you want to test everybody who has HIV, this doesn't work. You need to go towards people, you need to move out of clinics.
We are in one of the areas where our community health agents walk long distances to cover the households that are scattered all over the place. It is very much important to have the door-to-door counseling and testing because it increases the access and it allows the people to test in the comfort of their own homes. People are really struggling to reach out to the clinics because the clinics are far from their areas.
There is a lot of people who are positive get tested and now they're not dying. They were happy for the program. Relax, thambisa isandla ukuze kuzophuma igazi.
Akikho la?